Following a tooth extraction, surgical gauze is often used to control the bleeding and allow for a blood clot to form around the extraction site. It's very important to preserve this blood clot to ensure that the gum socket heals correctly and is filled with new, healthy bones. Failure to do so can lead to a painful infection called dry socket. After surgery, avoid drinking from a straw or from a sports bottle that requires you to use a sucking action. Special precautions must be taken to prevent excessive bleeding or the dislodging of the blood clot. You must also avoid aggressive or forceful spitting after your surgery. This is to prevent causing further damage to the extraction site. Keeping your mouth clean after an extraction is important, but you should avoid vigorous rinsing, which could cause the blood clot to be dislodged. If you need to rinse your mouth, you should do it gently and carefully. Lastly, smoking should be avoided at all costs after any type of oral surgery, since it is known to delay the healing process and increases the probability of dry socket. Surgical gauze will then be placed over the extraction site, while you are instructed to bite down over the socket for at least half an hour. The pressure on the socket will help in controlling the bleeding, as well as assist in forming the blood clot.